Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. A woman in Bihar's Muzaffarpur town will settle for nothing less than a kidney from a doctor at a private nursing home who she accused of stealing her organs and putting her on permanent dialysis after she had gone to him with a uterus infection. The accused doctor, RK Singh, is on the run, while Sunita Devi, 38-year-old, is now being treated at a state-run hospital in her hometown where regular dialysis is keeping her alive. Opined that by permitting fake pharmacists to run medical stores, it will be playing with the life of the citizens. The Supreme Court has sought the Bihar government about the steps being taken to stop the functioning fake pharmacists. The issue of fake pharmacists functioning in the state was raised by Mukesh Kumar, who had filed a public interest litigation before the Patna High Court. The petitioner alleged that in several government-run hospitals, the persons who are not a registered pharmacist are being allowed to discharge the function of a pharmacist. Coming to the rescue of 29 MBBS students belonging to Rajarajeshwari Medical College, the Karnataka High Court on Monday directed the institute to refund the excess amount collected from them, which was over and above the fee prescribed by the state government during the academic year 2017 to 2018 to 2020 to 2021. As per the earlier recommendation made by the Admission Overseeing Committee, the college will have to return the extra amount with 6% interest, further considering the welfare of the parents and the citizens of the state, and to stop the colleges from collecting excess fee. The High Court bench, comprising of Justice B. Veerappa and K.S. Himalika, has also directed the state government for issuing general instructions to all the colleges in this regard. Depression affects almost 300 million people worldwide, and women are twice as likely to experience it than men. Notably, the incidence of depression in women peaks in the years around menopause. Menopause is a long process that generally begins in a person's mid-40s and can continue for more than a decade. Depression caused by menopause can be more severe than that experienced by pre- and post-menopausal women. A growing number of women are turning to hormone replacement therapy to alleviate distressing symptoms of the menopause, including hot flushes, bladder weakness, vaginal dryness, joint pain, brain fog, sleep disturbances, anxiety, and depression. For many women, HRT can help manage symptoms and minimize disruptions to daily life. The past 5 years alone has seen monthly prescriptions of HRT double in England. Part of this increase is thanks to continued research on the wide-reaching benefits of HRT and awareness campaigns by menopause specialists and celebrities such as Davina McCall. As research into HRT continues, it's understandable that women may be concerned when they see studies or headlines showing potential harms from HRT use. Take a recent Danish study which showed a link between HRT use and depression. Many media outlets reporting on these findings initially suggested that HRT makes women depressed. But while the study may have identified an association between HRT and depression, it did not actually show that taking HRT made women depressed.
Diabetes is a critical public health problem in China, and the onset and progression of the disease is largely governed by behavioral and environmental risk factors. The nation's rapid urbanization and economic growth has resulted in a dramatic increase in urban lighting and the number of people exposed to it. A new study published in Diabetologia, the Journal of European Association for the Study of Diabetes, finds that outdoor artificial light at night (LAN) is associated with impaired blood glucose control and an increased risk of diabetes, with more than 9 million cases of disease Chinese adults being attributed to light at night exposure. Ankle arthroscopy is most effective when pain is due to contact between bone spurs and the arthritis has not yet caused significant cartilage damage. Arthroscopy can make an arthritic joint deteriorate more rapidly. Patients with advanced ankle osteoarthritis who undergo surgery see equally good outcomes from the two main surgical treatments for osteoarthritis, a new study led by UCL researchers has shown. The TERVA randomized clinical trial compared total ankle joint replacement with ankle fusion when ankle joint is pinned to prevent movement. It was led by Comprehensive Clinical Trials Unit at UCL and involves 17 NHS trusts across the UK. Non-alcohol fatty liver disease is the most common chronic liver disease in the US, affecting more than 30% of adults. It is characterized by hepatic steatosis in the absence of substantial alcohol consumption, long-term use of steatogenic drugs, or genetic disorders. Reporting their results in the JAMA network, researchers from the State University reported that obese patients undergoing bariatric surgery were nearly 50% less likely to develop adverse cardiovascular events such as heart attacks, angina, or strokes. Autism spectrum disorder is a developmental disability caused by differences in the brain functioning. People with autistic spectrum disorder often have problems with social communication and interaction, and they show restricted or repetitive behaviors or interests. People with autistic spectrum disorder may also have different ways of learning, moving, or paying attention. New research findings in the mouse models of one genetic risk for autism support the idea that loss of a specific gene interferes with cells in the brain whose role is to inhibit signaling. Though there are fewer of these cells than other neurons and their signals don't travel very far, they have enormous influence on patterns of information transmission within the brain and to the rest of the body. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.